Welcome to Field Notes, Insights from N2PH Health Alumni. N2PH Health is a year-long workforce training program for those who are new into the field of public health. I'm Juliana Mansky.
And I'm Mackenzie Legal. We are program facilitators and hosts of this podcast. With a vibrant community of over 400 current and past residents, N2PH Health is a wealth of knowledge and experience in the public health field.
In each episode, we'll share inspiring stories and valuable insights from those who've journeyed into public health, highlighting their unique path and the impact they're making.
Joining us today is Shelby Schupee in Corvallis, Oregon. Shelby is about to hit the first decade of her career spanning the educational, legal, and now public health field. Shelby uses her knowledge in conflict resolution and health equity wherever she goes, but recently found a love for public health. Shelby graduated from N2PH Health in the fall of 2024. Shelby, how did you find public health and the N2PH Health program?
Thank you so much for having me, Mackenzie. I'm so excited to talk about this. I love public health, and I found it through the same means that I think a lot of people figured out that they didn't like public health too much. So I started at a university during COVID, right when it hit. And I got to work really closely with our local public health department and just the different organizations, the public health organizations that were working on COVID-19. And I will be completely honest, and that navigating COVID-19 did not make me want to go into public health necessarily. But when I saw a health equity position open up with a local public health agency, it just sounded really exciting to me. I was really intrigued by the opportunity to talk about health equity and tackle health disparities, and to really use my background to spark these sometimes challenging conversations that are super necessary around equity and inclusivity within public health. So public health is definitely not my background or expertise per se, but it is something that I was certainly very interested in and was excited to kind of try it out. And I was super fortunate to go to the NACHO 360 conference in my first year. So the conference that the National Association for City and County Health Officials, they put on this really big conference, and I found Juliana at the N2PH Health table when I was walking around. And we chatted a bit, and I thought it was really, really interesting, and had mentioned to her that, I wasn't from the public health field and that it sounded like a really good opportunity. And she encouraged me to look more into it. So I did. And I brought it back to my program, and my director signed me up right away. So the N2PH Health program really opened the doors for me to what public health is, what it could be, really gave me this amazingly full picture of public health, and it helped me better navigate my job and really approach it from a really holistic picture of what public health is, as well as getting to talk to all of these different colleagues from all over the US. I was able to bring a lot of really cool ideas back as well. And I think it also has really set me up for my future, for moving forward. I can't talk good enough things about N2PH Health and how much it has supported my understanding of public health, and really how I approach my work and my personal life. I will add like a small personal side note to it, that it being in public health did make me a little bit more of a germaphobe, but all for good reason. It was so interesting, just getting to learn all about it throughout the program and my first job in public health.
And how do you see New to Public Health in helping you moving forward in your career?
Yeah, so like I said, the New to Public Health program really gave me just such a good understanding of the field, and that helped me kind of realize that even though my background is not in public health, I can take public health with me everywhere. So I have definitely been prioritizing, looking for positions in public health. I'm not currently with the organization that I was with before, but I'm really trying to look for stuff that involves public health and health equity, and the stuff that I learned from the New to Public Health program, because it really did give me such a comprehensive understanding of the field. I'm able to look at really unique positions that include things like emergency preparedness and climate work and uh, quality improvement and like leadership development. So it's really exciting. I think it's public health is just such a broad field, and it's just such a fun field. And so I really am looking to stay in public health, and I definitely would recommend that if anyone is even remotely interested in something related to public health, but your background isn't in it, I think it's really worth checking out still, because there's just so much. There's so much to it. And public health really, I genuinely feel like public health is for everyone. I was told that within my first year, and I was like, what are you talking about? I just didn't quite understand that in the first few months that I worked in public health, but after working in the field and being able to go through the New to Public Health program, I do think it's a field that's for everyone, and it has just so many different facets that your interest will probably fit into a public health role, and you'll be able to make a huge impact on your community. And that's really what I'm aiming to continue doing. So yeah, it's just a huge thank you to the New to Public Health program for yeah I feel like setting me up for success. So yeah.
Thank you for listening to Field Notes, Insights from New to Public Health Alumni. For more information, visit new2publichealth.wisc.edu.